Good afternoon, everyone, and thank you for joining our press briefing on the City of Philadelphia's response to COVID-19. As a reminder, the Zoom is for press only. If you're not a member of the press, please be sure to log out and join via one of our live streams that are available, including the Department of Health's Twitter and Facebook accounts, phila.gov/PHLGovTV, Comcast Channel 64, or Verizon Channel 40. We'll now begin our briefing with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thank you, Lauren. Good afternoon, everyone. This is our first conference since the holidays. So I want to start by thanking all the Philadelphians who heeded medical guidance and avoided travel and large gatherings over the past few weeks. I know it was hard to stay home for the holidays. I know it was difficult not to invite your relatives and friends over. I know it was painful to take a year off from many beloved family traditions. But your decision was the right one for you, for your immediate and extended family members, and for our city as a whole. Curtailing our holiday celebrations was a huge sacrifice. It is the latest example of the great many sacrifices that many have made since last March in order to slow the spread of this horrible and deadly virus. So again, I thank you for doing the right thing. As many of you know, yesterday brought the expiration of some of our restrictions on certain business activities. Under the revised order, gyms and museums, in-person learning for high schools, outdoor catered events, and outdoor sports are allowed to resume. Of course, for the indoor activities, masks must be worn at all times, and density must be limited to fewer than 5 people per 1,000 square feet. So as we start the new year, I'm very pleased that at least for some activities, we've been able to ease restrictions. In the near future, we will provide updates on other activities that currently remain prohibited or limited through at least January 15th. Dr. Farley and his staff at the Health Department are monitoring case counts following the holidays, and that data will guide us as we evaluate all the restrictions going forward. Diligence, common sense, and adherence to the basic guidelines will all help boost the chances that we'll be able to ease more restrictions and, more importantly, stay open. As many of our residents know, the city began coordinating food and meal distributions in March as part of our emergency pandemic response. Working in partnership with the Food Program and Philabundance, food sites are available across Philadelphia where families can access free and healthy foods. We will continue this partnership into the new year as food access remains a concern in many households. Beginning this week, there are updates to both locations of the meal sites and the weekly distribution schedules. So I encourage families to call 311 or visit phila.gov/food to confirm the new locations and schedules of food sites near them. Again, that's phila.gov/food. And now, Dr. Farley.
Thank you very much, Mayor. I have mixed news today. We're seeing indications of increases in the case counts related to the holidays, and we have continued concerns about the new variant of the virus. I'll talk about that, and I'll give an update on vaccination and an update on our restrictions. First, though, the numbers. Since this time yesterday, we've identified 805 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total of 94,127 cases since the beginning of the epidemic. And in addition, there are 111 new probable cases diagnosed by the rapid antigen tests. Now, as has happened in previous Tuesdays, we received a very large number of lab test results today, more than 12,000. So that's part of the reason for the higher number than we're seeing on average. Now, with the rapid antigen testing becoming more common, I'm going to be changing the way we report our numbers a little bit. I'll start reporting our weekly totals and the percent positive, including the rapid antigen tests with the overall confirmed PCR tests. We have a graph on our website now which clarifies the number of positives and the number of negatives for both the PCR tests and the rapid antigen tests, so you can calculate the numbers and percent positive separately if you want to. For the past week, from December 27th to January 3rd, we averaged 487 cases per day. That's PCR and antigen tests combined. That's so far. We expect more with the delayed in reporting. And of those people tested, 9.1% of people tested positive. Now, just note that there were fewer tests done last week because of the holiday. Now, that compares to the previous week, from December 20th to the 26th, when we averaged 570 cases per day, and 8.7% of the tests were positive. So for this past week, then you see that we had a decrease in the number of cases, but an increase in the percent positive. Overall, I'd say that means that the epidemic was about the same last week as it was the week before. Now, before Christmas, the cases in Philadelphia were decreasing fairly well, So the fact that they have leveled off during this past week is an unwelcome change. We don't want to see that. And I do think that that's likely caused by social gatherings that happened over the Christmas holiday. In part, that's also because we're seeing increases in cases all around us. The 7-day average for the United States as a whole is now above more than 200,000 cases per day after it fell below before Christmas. And then for the entire state of Pennsylvania, we're averaging about 7,400 cases per day, and that's been climbing in the past few days. And we're seeing substantial increases in case counts in New Jersey, in New York, and the New England states. Likewise, I think all this, given its timing, is probably related to the social gatherings that occurred over Christmas. Now, back here in Philadelphia, where are we with hospitalized patients? This morning, we had 693 patients with COVID hospitalized in Philadelphia hospitals. That number has been generally decreasing since about the middle of December. What about COVID-related deaths? We have 36 newly identified COVID-related deaths to report today, unfortunately, bringing us to a total of 2,521 since the beginning of the epidemic. Now, we peaked at about 94 deaths per week in the week of December 13th, and it appears to be falling since, although it's not falling quickly. These are high numbers, and these high numbers are clearly related to the high case counts we've been seeing here in recent weeks. Now, let me go on to this new variant virus. The new variant of the virus was first seen in the United Kingdom. It's something that is now being called B117. Don't ask me exactly why, but it's being called B117. Now, in the United Kingdom, they're seeing an explosive growth in cases across the nation. And the model suggests that this B117 variant is the reason for that. In response to that, the United Kingdom just yesterday reported a very tight lockdown, as tight as we had here in the spring, including closing all of their schools. Now, this new variant has now been found in dozens of other countries around the world and in 4 different states around the United States. Now, it hasn't been identified in Philadelphia yet, but we do very little of the specialized testing here in Philadelphia. So it may very well be here, we don't know it. The laboratories that are testing for this now, and I do think likely it will be identified here eventually sometime in the city. Right now, if anyone has recently traveled to the United Kingdom and test positive, call the health department and we may request an additional sample for further testing. And this is clearly something we have to continue to watch. Now on to the vaccine. The distribution of the vaccine is continuing here in Philadelphia. We're managing with the small number of doses we're getting to us each week. And we're managing around the complexity of handling these vaccines, which have their own storage requirements, and the fact that we're vaccinating during a pandemic, and that we have a limit on our distribution over the holidays. We're still working on our first priority group. Those are people who work in healthcare settings, healthcare workers, and are exposed to COVID in their healthcare jobs, as well as people who live and work in nursing homes. Now, as of this past Sunday, we had data demonstrating that we vaccinated 28,476 people. That represents 39% of the doses that have been allocated to the Philadelphia so far. Now, we don't have data yet from nursing homes. And so remember that some of the nursing home doses got taken out of our total allocation. The first people who were vaccinated the very first week will be getting their second dose of the Pfizer vaccine this week. Now, this week, we've been allocated 9,500 additional doses of the Moderna vaccine, 9,750 doses of the Pfizer vaccine. Now, of that Pfizer vaccine, 3,900 doses are going to be going to pharmacies to vaccinate people in nursing homes, in addition to the other doses in previous weeks we sent to pharmacies for vaccinating in nursing homes. Now, we've been told that these numbers, 9,500 of Moderna and 9,750 of Pfizer, are the same amounts we're going to get per week, weekly through the end of January. To be clear, in a city of 1.6 million people, this is not enough. At this rate, it'll take more than 12 months to vaccinate the entire population of the city of Philadelphia. So we certainly hope that the delivery of vaccines to us increases. Now, what are we doing with that vaccine? We're continuing to vaccinate in hospitals, but we're now expanding to other sites to reach healthcare workers that don't work in hospitals, what we're calling unaffiliated healthcare workers. Last week, the vaccine was given to the federally qualified health centers. These are large clinics in the city for them to vaccinate their own healthcare workers. The staff at nursing homes, along with their residents, that vaccination initiative conducted by pharmacies started last week. Last week, from the data we have, they vaccinated just at one facility. But this week, the pharmacies are scheduled to go to 22 different nursing homes across the city. The pharmacies are projecting it'll last about 2 months for them to get through both doses in all the nursing homes in the city. Now, this week, we'll be providing more sites to vaccinate these unaffiliated healthcare workers, the ones that don't work in hospitals, such as primary care physicians and their staff at private offices, and such as home health aides. We have an agreement with the Rite Aid Pharmacy for them to provide vaccination at their sites. There are 26 sites across the city where these healthcare workers can be vaccinated. Now, here's something that's very important I want to make sure everybody understands. These sites are not for anyone other than healthcare workers who have specifically been invited and who have appointments to be vaccinated. They're not for walk-ins. I want to repeat that. The Rite Aid vaccination sites are only for healthcare workers who have been invited to go there and have appointments. They're not for walk-ins. Now, I say that because there are many people who are eager to get this vaccine. We're getting lots of contact with people who want to get the vaccine, and we're glad that people are eager to get the vaccine. Over time, everyone who wants to get the vaccine will be able to get it. But with the number of doses that we're receiving each week now, it's going to take us months to get through everyone. Now, we're doing healthcare workers now. After healthcare workers, the next group will include frontline essential workers. Those are people who are exposed to many other people daily as part of their job and are at risk of acquiring the infection and then transmitting it to people who themselves may be vulnerable. Even that group, though, we're not likely to get to for weeks. So for everyone who is eager to get the vaccine, we ask you to please be patient. We understand you want to do this, and we want to get to you as soon as possible, but we simply can't do it right now. And I should point out that even people who are receiving the vaccine will need to continue to wear masks and practice social distancing for months anyway, vaccinated or not. Now also, while many people here are eager to get the vaccine, there are others who are reluctant to get the vaccine, we're discovering. We now have the first data available to us on the race and ethnicity of the people who have been vaccinated, mainly in hospitals. And our data is going to be posted on our website. And here's the first breakdowns we have of the people who were vaccinated. 19% of these people, their race and ethnicity was unknown. 43% were Caucasian, 5% Hispanic, 12% African American, 10% Asian, and 10% other. Now, we don't have data on the racial breakdown of the hospital staff in general, but we believe these data reflect an underrepresentation of minority workers who are eligible, particularly African Americans. So I've discussed this with the hospital's chief medical officers. We know that all the workers that are exposed to patients are being offered vaccine. That includes, for example, the housekeeping staff who work in emergency rooms and the dietary staff within hospitals. But it appears that minority staff, particularly African American staff, are less likely to schedule an appointment to get the vaccine and to accept the vaccine if it's offered to them. We believe that they have less trust in the medical care system. Let me say that that's completely understandable given the history of how African Americans have been treated in this country historically and through today. But it is still a problem because we know that African Americans are more likely to get COVID and more likely to die of COVID. So I've asked the hospital chief medical officers to really work on this problem, to listen to the concerns of their staff, to address any practical barriers they have to people getting vaccinated, and to highlight role models, even within their own system, of people who've been vaccinated and feel good about it. And we hope this number will improve as everyone sees others getting vaccinated and doing well. We'll be posting data and updating this data on our website. Now, just an update on our safer at home restrictions. Since we put our restrictions in place from November 20th through January 3rd on Sunday, the case rates in Philadelphia have fallen 38%. The case rates in the entire Commonwealth of Pennsylvania have risen 20%. We do think that that's related to these restrictions. Now, in the past week, we've seen increasing cases in all the suburban counties, as I mentioned. And I do believe that that's evidence that the Christmas has caused that increase in cases, as we predicted. Now, I'm concerned about this increases in the region and that the fact that they may likely cause increasing spread in Philadelphia. And I also am concerned that we haven't seen the full effect of the New Year's holiday yet. Now, as the mayor said, effective yesterday, we lifted prohibitions on the somewhat less risky settings, including museums, outdoor sports, gyms, high schools for in-person learning, outdoor catered events, the casino. But for all of those, there are restrictions on how they operate, which will remain in place. Most important, for all the indoor activities, including gyms, people must wear masks at all times. And the density has to be less than 5 persons per 1,000 square feet. We have detailed guidance for each of these settings that's posted on our website. Now, we'll maintain the current restrictions for the riskiest settings at least through January 15th. That includes no indoor dining at restaurants, no indoor gatherings and events, no theaters, no in-person education at colleges, and no indoor organized sports. So we'll watch the case counts over the next few days to determine if we can back off on these restrictions after January 15th, and we'll notify you when we've made our final decision. Now, let me mention one other concern we have, and that is college students returning to Philadelphia after the holidays. We saw a surge in cases here in Philadelphia in early September when the college students first arrived for the fall semester, which appeared to related to social events that the college students had more than any other opportunity at the college campus. We don't want to see a repeat of that now. So we're working with the colleges to try to prevent social gatherings among students of any size, even small social gatherings we believe are a risk. We think that's for the sake of the colleges, for the sake of the college faculty, as well as the sake of the city as a whole. And in general, what should people in the city of Philadelphia do now? Well, I'll just remind people that the vaccine, unfortunately, will not be here in enough doses to help us get through this winter wave. We need to use the tools we already have in order to get through this winter wave of the epidemic. That means no indoor gatherings. The indoor social gatherings really are the worst setting overall in this epidemic. We've learned that. No parties, no inviting friends over, no sleepovers for kids. Also, no travel, because when you travel, you end up getting together with others. If you do get together with others here in the city, do it outside and do it with masks. And if you go out for errands, make sure you wear a mask everywhere. So more information on all of this information about the vaccine, as well as the restrictions, is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now we'll turn it over to Armando to provide the Spanish language translation of today's remarks.
Palabras del alcalde Jim Kenney para el 5 de enero del 2021. Buenas tardes a todos. Esta es nuestra primera conferencia de prensa desde las fiestas de fin de año, así que quiero comenzar agradeciéndoles a todos los habitantes de Filadelfia que cumplieron con la orientación médica y evitaron los viajes y las grandes reuniones durante las últimas semanas. Sé que fue difícil quedarse en casa durante las vacaciones. Sé que fue difícil no invitar a sus familiares y amigos a celebrar estas fiestas. Sé que fue doloroso saltearse este año de muchas tradiciones familiares tan queridas. Pero su decisión fue la correcta. Para usted, para sus familiares inmediatos y extendidos y para nuestra ciudad en general. Reducir nuestras celebraciones navideñas fue un gran sacrificio, pero valió la pena. Es el último ejemplo de muchos sacrificios que muchos hemos tenido que hacer desde el marzo último para frenar la propagación de este horrible y mortal virus. Y entonces, nuevamente, les agradezco a todos por haber hecho lo correcto. Como saben muchos, ayer culminaron algunas de nuestras restricciones para ciertos negocios y ciertas actividades. Según la orden revisada, los gimnasios y los museos, el aprendizaje en personas para las escuelas secundarias, los eventos al aire libre y los deportes al aire libre pueden reanudarse. Por supuesto, para las actividades en interiores, se deben usar mascarillas en todo momento y la densidad se limitará a un máximo de 5 personas por cada 1,000 pies cuadrados. Así que, al comenzar el nuevo año, me complace mucho que, al menos para algunas actividades, hayamos podido reducir las restricciones. En un futuro cercano, vamos a proporcionar actualizaciones sobre otras actividades que actualmente siguen prohibidas o están limitadas hasta al menos el 15 de enero. El Dr. Farley y su personal en el Departamento de Salud están monitoreando los recuentos de casos después de las fiestas y esos datos nos guiarán mientras evaluamos todas las restricciones en el futuro. La diligencia, el sentido común y el cumplimiento de las pautas básicas ayudarán a aumentar las posibilidades de que podamos reducir aún más estas restricciones. Como muchos de nuestros residentes lo saben, la ciudad comenzó a coordinar la distribución de alimentos y comidas en marzo como parte de nuestra respuesta de emergencia a la pandemia. Trabajando en asociación con Food Program y Philabundance, hay sitios de alimentos disponibles en Filadelfia donde las familias pueden acceder a alimentos gratuitos y saludables. Continuaremos esta asociación en el nuevo año, ya que el acceso a alimentos sigue siendo una preocupación en muchos hogares. A partir de esta semana, habrá actualizaciones tanto de las ubicaciones de los sitios de comidas, así como de los horarios de distribución semanales. Así que animo a las familias a que llamen al 311 o visiten phila.gov/food para confirmar las nuevas ubicaciones y los horarios de los sitios de comida más cerca de su hogar. Y esta es la actualización en materia de salud para el día 5 de enero del 2021. Comenzamos con noticias mixtas. Hay indicaciones de un aumento de casos relacionado con las fiestas de fin de año y nuestra preocupación sobre la nueva variante del virus. Asimismo, proporcionaremos actualizaciones sobre la vacunación en Filadelfia y el estado de las restricciones. Primero, los números del día de hoy. En cuanto a casos, reportamos 805 nuevos casos confirmados por la prueba PCR. El total de casos confirmados es de 94.127 casos. Tenemos 111 casos nuevos probables por la prueba rápida de antígenos. Hoy hemos recibido un gran número de resultados, más de 12.000. Con las pruebas rápidas de antígenos, cada vez más comunes, comenzaremos a informar los totales semanales y el porcentaje de positividad de estas pruebas también. La semana pasada, del 27 de diciembre al 3 de enero, el promedio de caso fue de 487 casos diarios. Estos datos provienen de las pruebas de PCR y de antígenos. Hasta ahora, y esperamos que este número se incremente, el 9,1% de las pruebas resultaron positivas. Es importante destacar que se realizaron menos pruebas la semana pasada debido a las vacaciones y a las fiestas de fin de año. La semana anterior, del 20 al 26 de diciembre, el promedio había sido de 570 casos por día, con un 8,7% de positividad. Entonces, tenemos un escenario en el cual disminuyen los casos, pero está aumentando el porcentaje de positividad. Vemos aumentos en los casos en los Estados Unidos en general y en Pensilvania en particular. En los Estados Unidos tenemos más de 200.000 casos diarios después de una disminución previa. En Pensilvania se promedian 7.400 casos por día, aunque esta cifra va en aumento. Hay también aumentos sustanciales en Nueva Jersey, en Nueva York y en los estados de Nueva Inglaterra, probablemente relacionado con las reuniones sociales durante la Navidad y el Año Nuevo. Con respecto a los pacientes hospitalizados, tenemos 693 pacientes internados con el COVID-19 en los hospitales de Filadelfia esta mañana. Este número sigue disminuyendo desde el día 17 de diciembre. En cuanto a las muertes, hay 36 recién fallecidos identificados el día de hoy, con un total de 2.521 fallecimientos. Alcanzamos un máximo de 94 muertes la semana del 13 de diciembre, pero este número, felizmente, parece estar disminuyendo. Con respecto a la nueva variante del virus. La nueva variante del virus fue vista por primera vez en el Reino Unido y algunos la están llamando B1.1.7. El Reino Unido está experimentando actualmente un crecimiento explosivo de los casos. Los modelos sugieren que la variante B1.1.7 es la razón de este aumento. El Reino Unido respondió ayer con un cierre bien estricto, como el que se implementó aquí en la primavera, incluyendo el cierre de las escuelas. La nueva variante ahora se encuentra en docenas de otros países en el mundo, incluyendo al menos 4 estados en los Estados Unidos. No se han identificado aún casos en el área de Filadelfia, pero probablemente se identifiquen aquí eventualmente. Por favor, si alguien viajó recientemente al Reino Unido y da positivo en la prueba, llame al Departamento de Salud para que le tomen una muestra para realizar más pruebas. Y ahora vamos a hablar sobre la vacunación. La distribución continúa. Estamos manejando una pequeña cantidad de dosis disponibles y los retos que esto implica. Hay complejidad en el manejo de estas vacunas y también el hecho que se da la vacunación durante un periodo de pandemia. Hay límites en cuanto a la distribución debido a las vacaciones y a las fiestas de diciembre. Y todavía estamos vacunando solamente al primer grupo de prioridad, es decir, a las personas que trabajan y están expuestas al coronavirus en entornos de atención médica y en los hogares de ancianos. Hasta el día domingo tenemos datos que muestran la vacunación de 28.476 personas. Esto corresponde al 39% de las dosis asignadas. Todavía no tenemos los datos de los hogares de ancianos. Las primeras personas vacunadas recibirán una segunda dosis de Pfizer esta semana. Esta semana se asignaron 9.500 dosis de la vacuna de Moderna y 9.750 dosis de la vacuna de Pfizer. De estas dosis, 3.900 van a farmacias para vacunar a los hogares de ancianos. Nos dijeron que vamos a recibir las mismas cantidades semanalmente hasta fines de enero. Pero esto no es suficiente. A este ritmo se necesitarían muchos meses para vacunar a toda la ciudad. Continuaremos luego en los hospitales, pero también vamos a expandir la vacunación a otros sitios para llegar a los trabajadores esenciales no hospitalarios. La semana pasada entregamos vacunas a los centros de salud federalmente calificados para vacunar a su personal. La vacunación del personal en hogares de ancianos, que se realiza por las farmacias, comenzó la semana pasada. El tiempo proyectado por las farmacias es que esto dure aproximadamente 2 meses. La semana pasada comenzó la vacunación en una instalación. La vacunación en 22 otras instalaciones está programada a comenzar esta semana. Igualmente, esta semana estamos brindando más sitios para vacunar a los trabajadores de salud que no trabajen en hospitales, como los médicos de cabecera y su personal, asistentes de salud en el hogar. Hemos llegado a un acuerdo con Rite Aid para vacunar en 26 sitios. Es importante notar que no habrá citas para nadie que no sea trabajador de la salud. Toda la vacunación se realizará previa cita e invitación. Les repito, solamente el personal de salud está invitado y tendrá citas durante esta etapa. Con el tiempo, todas las personas que quieran vacunarse podrán recibir la vacuna, pero con la cantidad de dosis que se reciben semanalmente, nos tomará meses ofrecer la vacuna a todos aquellos que quieran recibirla. Después de los trabajadores de la salud, el próximo grupo incluirá a trabajadores esenciales en primera línea. Estas son personas expuestas a otros diariamente como parte de su trabajo. No es probable que se llegue a este grupo todavía en semanas. Para todos aquellos que estén ansiosos, les pedimos que sean pacientes. Nos comunicaremos al respecto lo antes posible. Un recordatorio importante es que todos todavía necesitamos usar las mascarillas y practicar el distanciamiento social durante los meses que siguen, de todos modos, estemos vacunados o no. Si bien hay algunas personas que están ansiosas por recibir la vacuna, hay muchas otras que están reacias a recibirla. Y tenemos los primeros datos sobre la vacunación de parte de la raza y la etnia de aquellos que han sido vacunados. Esta información proviene principalmente de los hospitales. Tenemos un 19% que no indicó raza o etnia, un 43% de caucásicos o blancos, un 5% de hispanos, un 12% de afroamericanos, un 10% de asiáticos y un 10% de otras razas o etnias. No tenemos los datos sobre el desglose racial del personal de los hospitales, pero creemos que estos trabajadores minoritarios elegibles corresponden a la comunidad afroamericana. A todos los trabajadores expuestos a pacientes se les ha ofrecido la vacuna, incluyendo al personal de limpieza en los departamentos de emergencia y al personal que prepara los alimentos, entre otros grupos. Pero parece que el personal de algunas minorías, especialmente la comunidad afroamericana, es menos probable que programe una cita y que acepte la vacuna aun cuando se les ofrece, porque ellos tienen menor confianza en el sistema de atención médica, y esto es comprensible, dado el historial de cómo se ha tratado a la comunidad afroamericana en este país. Pero sigue siendo un problema, porque es la comunidad afroamericana que tiene más probabilidades de contraer el COVID. Le he pedido a los directores de los hospitales que enfrenten este problema, que escuchen a las preocupaciones y que aborden las barreras prácticas para estas comunidades. Se debe destacar los modelos a seguir, incluso dentro de los sistemas hospitalarios, al personal que se ha vacunado ya y que se sienten bien al respecto. Esperamos que esto mejore a medida que esta gente vea que las otras personas que ya han sido vacunadas les va bien con la vacuna. En cuanto a las restricciones del programa Más Seguro en Casa, desde que entró en vigor el 20 de noviembre hasta el 2 de enero, la tasa de casos en Filadelfia cayó en un notable 38%. Las tasas en los casos en la mancomunidad durante este tiempo aumentaron en Pensilvania en un 20%. En la última semana aumentaron los casos en todos los condados suburbanos. Esto es prueba de que las fiestas han provocado un aumento de los casos, como lo habíamos anticipado. Y estamos preocupados por los aumentos en la región, y esto se ha extendido a Filadelfia, porque aún no hemos visto el efecto completo de las fiestas del Año Nuevo. A partir de ayer, se eliminaron las prohibiciones en entornos un poco menos riesgosos, tales como los museos, la práctica de los deportes al aire libre, los gimnasios y las escuelas secundarias que tienen aprendizaje en persona, incluyendo también los eventos con catering que se den al aire libre. Pero las restricciones sobre cómo operan permanecen vigentes para todos estos entornos. Lo más importante es que para todas las actividades en interiores, incluyendo los gimnasios, se deben usar mascarillas en todo momento. Y continúan aún las restricciones relacionadas a la densidad de las personas, limitándose a un máximo de hasta 5 personas por cada 1,000 pies cuadrados. La orientación detallada se encuentra publicada en nuestro sitio web. Vamos a mantener las restricciones actuales para los entornos más riesgosos, al menos hasta el día 15 de enero. Los restaurantes con servicio en interiores, las reuniones y eventos bajo techo, los teatros, universidades y los deportes organizados que se dan en interiores. Vamos a observar los recuentos de los casos durante los próximos días para determinar si se puede dar marcha atrás a estas restricciones después del día 15 de enero. Y tenemos otra preocupación, que es los estudiantes universitarios que regresan a Filadelfia. Hemos visto un aumento en los casos a principios de septiembre, que coincidió con la llegada de los estudiantes universitarios, especialmente por sus eventos sociales, y no queremos que esto se repita ahora. Por lo tanto, estamos trabajando con las universidades para tratar de impedir o prevenir las reuniones sociales entre los estudiantes. Esto abarca a reuniones de cualquier tamaño. Esta medida es por el bien de ellos y por el bien de la ciudad. ¿Qué es lo que debería hacer la gente ahora? Recordar que la vacuna no nos ayudará a superar esta ola del invierno todavía. Necesitamos utilizar herramientas que ya tenemos y que han funcionado. Por lo tanto, no se permiten reuniones sociales en interiores porque estas son las peores maneras de esparcir el virus. No a las fiestas, no a las pijamadas y no invite a sus amigos a su hogar. Tampoco debe viajar, porque cuando viajas te juntas con los demás, aunque tomen todos medidas extremas. Si se junta usted con personas que no son de su hogar, hágalo al aire libre, usando mascarillas. Cuando salga a hacer diligencias, use la mascarilla en todas partes. Algunos se preguntan, ¿por qué la distribución de las vacunas es tan lenta? Porque el gobierno federal estableció expectativas irrazonablemente altas. El primer paso es simplemente entregarle las vacunas a los estados y a las ciudades, pero hay que cumplir con muchos pasos más para poner la vacuna en los brazos de los ciudadanos. La vacunación y la situación actual es compleja. La vacuna misma es complicada. Esto no es como una vacuna contra el polio en la cual todos hacen fila y están listos en segundos. Las personas deben esperar 15 minutos después de la inyección para asegurarse que no tengan una reacción alérgica. Hay requisitos también en cuanto al manejo de estas vacunas, como por ejemplo el almacenamiento ultrafrío. Se debe mantener el distanciamiento social en los sitios de vacunación. Los suministros son muy limitados y no podemos vacunar a todos a la vez. Tenemos que establecer clínicas para atender a poblaciones especiales. Y hay incertidumbre sobre la cantidad de dosis que recibiremos y las poblaciones prioritarias que dificultan la planificación de la administración en estas clínicas. No se puede planificar un sitio de vacunación en una comunidad grande si no sabemos cuántas dosis van a estar disponibles para distribuirse o si se va a vacunar, por ejemplo, a los residentes de hogares de ancianos o trabajadores de la salud o personas mayores de 75 años que viven en su hogar. Otro factor fueron las fiestas de fin de año. Vamos distribuyendo la vacuna solo 3 semanas hasta ahora, y 2 de esas semanas correspondieron a los feriados de la Navidad y el Año Nuevo. Aún no hemos recibido los fondos federales para la distribución de las vacunas. Estamos haciendo este esfuerzo por ahora con el personal existente en el Departamento de Salud y en los sistemas de atención médica. Todos están ocupados luchando contra la epidemia al mismo tiempo. Los fondos federales del paquete de ayuda acaban de aprobarse, pero aún no los hemos visto. Hemos entregado el 39% de las vacunas asignadas hasta ahora, y este porcentaje es más alto que el que se muestra en el resto de Pensilvania, en Nueva Jersey, en Delaware, en Nueva York y en la mayoría de los estados. Si se descuenta las vacunas que van a las facilidades de cuidado prolongado, tenemos un 44% que hemos entregado hasta ahora. Estamos haciendo todo lo posible para distribuir la vacuna. Y nos vamos a adaptar a situaciones en constante cambio y mejoraremos con el tiempo. Nuestra meta es que todos los que quieran vacunarse reciban la vacuna. Pero hemos dicho que esto llevaría meses. Por lo tanto, les pedimos paciencia. ¿Qué es lo que nos haría falta para acelerar este proceso? Más dosis de la vacuna. Decenas de miles en lugar de miles. Y dosis predecibles. Con esto sabremos cómo administrarlas en clínicas masivas, por ejemplo. Si sabemos que tendremos cierto número de vacunas, podemos planificarlo mejor. Mientras tanto, el recordatorio es simple, pero efectivo. Utilice una máscara, observe distanciamiento social y, por favor, quédese en casa mientras sea posible. Juntos y solamente juntos podremos derrotar esta pandemia. Muchas gracias.
Thank you, Armando. We'll now move to Q&A for members of the press. In addition to Mayor Kenny and Dr. Farley, we're also joined by Managing Director Tumar Alexander today. Because of limited time, only one representative from each media outlet will be permitted to ask questions. Reporters are also asked to limit their questions to 3 or fewer. We'll be limiting the first round of questions to the topic of COVID-19. So if you have questions regarding other topics, please hold them for the second round. If your hand's raised and your question is not about COVID, please go ahead and lower that now, and we will let you know when we open it up to broader topics. I also know that a few people were having issues with the raise your hand function. So if you sent me a note in the chat about that, I have added you to the lineup. And we're going to actually go ahead and start with Sean Walsh today, who was one of the folks who was having that issue. So Sean, you should be able to unmute yourself and ask your questions.
Thanks very much. Dr. Farley, how do you feel about the city's pace so far in administering the vaccines? I know you commented on, the pace of receiving the vaccines, but how do you feel about the distribution of the vaccines locally? And could you also comment on whether this is happening statewide fast enough?
You're on mute, Doc.
Thank you, Mayor. A lot of interest about the pace of distribution of vaccines across the country. I think in part that's because the federal government set expectations that were unreasonably high about how quickly they could get the vaccine out. Just delivering the vaccine to the states doesn't mean that they get into people's arms. There's a lot of steps that need to take place. It's a complicated vaccine with different storage requirements. We need to maintain social distancing at sites. We have to set up clinics to meet where the priority populations are. And we had then the vaccine's been here for 3 weeks, and 2 of those weeks for holidays. So we would like to have more vaccines in people's arms now, but we're doing the best we can. I think we will adjust and improve as we get more vaccine and more experience with this.
Thanks. Have you made decisions on who will be vaccinated in phase 1B? And is there an estimate for how many people need to be vaccinated in 1A before moving to 1B?
Yeah, the 1A group is over 100,000 people. It may be as much as 130,000 people. Now, not all those people will choose to be vaccinated, but it's a fairly large group. As far as who's in 1B, we have we're generally trying to follow the federal guidelines, which include the frontline essential workers. But we've taken that question to our vaccine advisory group, and they had a discussion about it. They're doing a survey. And based upon that survey, we hope to have more definition of who's in the 1B group soon. And when we do that, we'll have a sense for how big that's going to be. That may be a very large group itself.
Thanks. And lastly, can you tell us about how the rollout for 1B might work? Will there be community sites, or will it be through hospitals, grocery stores? How will that look?
It will probably be a combination of sites. We have healthcare sites where people typically get vaccinations, pharmacies, there may be special vaccination clinics that we set up. We may be able to make it available at regular physicians' offices. So we'll try to tailor it to the populations we're trying to reach. Oh, and then or if there are large occupation groups that already have their own medical facilities, for example, we would give the vaccine to their medical providers of those occupation groups.
Thank you.
Thank you, Sean. Next up, we have Mitch Blocker from NBC 10. Mitch, you should be able to go ahead and unmute yourself.
Thank you. Dr. Farley, you said that 59% of the vials that you've received are sitting in storage. They're not in shots and arms. Where's the bottleneck?
As I was saying, there's a lot of steps to this process. And we have to set up the clinics, invite people to come on down. I think people might have an unrealistic expectation of when I was a kid, we had a polio vaccine. We all got the Sabin vaccine. We went to high school gym. Everybody just lined up. You walked in, they handed you a sugar cube, you swallowed it and walked on. Each person was a few seconds. It's not like that. These are vaccines. They're an injection. People have to wait 15 minutes to make sure they don't have an allergic reaction. And we don't want to just give it to anybody. We have set priority groups that are based upon how we can maximize the number of lives we save. And so that makes it more complicated. So, we would like to have more vaccine out there, but it's a variety of steps in the process in order to get the vaccine out. To speed up the process, more than anything, we need more doses. Even though we haven't disseminated all the doses we have, if we had more doses, we would definitely get more people vaccinated. And
that's the, I guess, the contradictory information, right? You have 25, 30,000 doses sitting in storage, and the question becomes, how are you going to speed up vaccinations?
Yeah, well, when you initially set up a system, you have to put vaccine in all these different sites. You don't expect that for every one dose you put out there, there's one person who comes in and gets it vaccinated. There's always going to be a certain inventory in all the sites you're going to have. And we hope that inventory is as low as possible so that we move people through as quickly as possible. But there's going to be some initial process in setting up that inventory. And again, I want to point out, we've had 3 weeks so far. 2 of those weeks were over Christmas and over New Year's. It's slow to get things going during that time. All this has been done, by the way, by a healthcare system that is still dealing with a pandemic and is very stressed with that, and by a public health system that has received 0 federal funds for the dissemination of the vaccine. The new relief package has in it funding for us to set up clinical operations to deliver the vaccine, but the money hasn't come here yet. So we haven't gotten out to everybody yet, but I think we've done a pretty good job. We're ahead of most places as far as the percent vaccinated, and we think we can improve.
And one last question. This new COVID strain is reportedly more contagious, as you mentioned. Are you going to be able to vaccinate people fast enough so that we don't have to have another shutdown?
I can't guarantee that. I would like to do that, but it all depends on how quickly the vaccine comes to us and then how quickly this variant arrives. And, there's still a lot we don't know about the B.1.1.7 variant. Is it as bad as we think it might be? I certainly hope not. So there's a lot of unknowns here. I cannot guarantee that we might not need to do a severe shutdown. I certainly hope not. None of us want to do it, me at most among everybody.
But the issue, I think, of a shutdown has more to do with people's behavior than it does with the vaccine. If people would behave themselves, wear their mask, keep a social distance, don't gather in large groups, we would be slowing this even more than we are now. I mean, certainly the vaccine is the long-term solution, the long-term resolution. But if people would behave themselves and do what we asked them to do, we would be slowing this even faster than we are now.
Thank you, gentlemen. Happy New Year.
Happy New Year.
Thank you, Mitch. Next up, we have Jeff Cole at Fox 29. Jeff, you should be able to unmute and ask your questions now.
Hello, all for Dr. Farley. Dr. Farley, just on this issue of distribution of the vaccine in the city, some communities, I think Camden County is one of them, are actually trying to find folks who will administer the vaccine, actually put it in the arms of people who are eligible to get it. Are you struggling with that? Do you have enough folks in the city who actually can do the injections for folks?
Yeah, we don't have a shortage of people who will deliver the vaccine. When you have a vaccination clinic, there's many more people you need to do various other sorts of tests than actually give the shot. There's a lot of information gathering and people need to sort of crowd control and watch people afterwards. So we don't have a shortage of vaccinators right now.
Doctor, when you speak to your federal contacts and who are providing you with the dosages, what are they saying about why you're getting what you think is a short number? What's the problem? Do they not have enough? Are they not making enough? Can they not get it to you?
Well, I looked and I can see we're getting essentially the same amount per capita as every other place around the country. So I think there are just not enough doses to go around in the country, and probably it's because the producers just can't produce it fast enough. You understand this is a new product, and producing vaccines at this scale is something they haven't done before at this pace. And so there's just not enough vaccine out there.
Doctor, if it takes 12 months for the city of Philadelphia to immunize its population, would that not be a huge and continued public health crisis here? The infection rate would continue. The number of deaths, I think you've just reported the number, would double, wouldn't it? I mean, the idea that it would take 12 months seems almost something you can't conceive of.
Well, I just wanted to give people a reality check, given the number of doses we're getting on a weekly basis. I hope that the vaccine manufacturers can speed up production so we get more vaccines. There also are 2 other vaccines that are in phase 3 trials that may be licensed. And if they do, then that opens up new vaccines, additional entire categories of vaccine that are available to us. I hope that happens in the next few months. And so we don't have to go into the fall with this. But it is going to be a long process. We do need to just sort of accept the reality of that. And which is why when we get back to the social distancing, we know how to prevent this without vaccines, we're going to need to be relying on that for quite some time now.
Thank you. Appreciate your time.
Thank you, Jeff. Next up, we have Johan Calhoun from Chalkbeat. Johan, you should be able to go ahead and unmute yourself now.
Thank you. I have 3 questions for Mayor Kinney and Dr. Farley. Are teachers still considered a part of the second priority group to get the vaccine? Will they be in the 1B group or the group after that?
Now, we still haven't given definition into the category of frontline essential workers. I would imagine they would probably be in there. But if you can wait until we have that more completely laid out, I can answer that question for you. I can tell you that that group is a large group. There's many, many people who fall in that category of frontline essential workers.
And I would like to see them get vaccinated as soon as possible. I mean, I believe they're essential workers, and I think they're even more essential in order for us to get kids back in school, to get people back to work. That's more back to normalcy than we've been used to in the last 10, 11 months. But I consider them, once we get them vaccinated, they feel comfortable going into a classroom setting. We get our kids back out of the house into school, and parents who have to stay home with their kids back to work.
All right, second question, for the most part, is for Dr. Farley. Since you gave 4 weeks for the first priority group, is it safe to say the next group, which includes teachers and school nurses, will get the vaccine, let's say, in early spring, like March?
Well, I can tell you that we may be moving to 1B, I can't say for sure, but best guess would be somewhere around February 1st. But that 1B group that has frontline essential workers, as I pointed out, is a very large group. So it may take us months to get through that entire group.
Okay, and to follow up with that, with the positivity cases where they are, and just like you said, with some teachers getting the vaccine late February, early March, what's the likelihood of schools returning back to in-person learning at all this semester?
Well, currently we are allowing schools to do in-person education, and the charter and the private schools and the parochial schools are open. And so I can't answer the question about whether the public schools will open, but they're allowed to be open right now. Certainly vaccination will help, but there are other things that schools can do to protect the teachers and the children.
What do you say to some teachers who might be hesitant about getting the vaccine? They look back on the Tuskegee experiment. And of course, there are cases in history in the country in which ethnic groups have been tested unfairly. So what do you say to those teachers or educators who are hesitant about getting the vaccine?
Yeah, what I would say to them, the same thing I would say to anybody else who's eligible for getting the vaccine, is that I understand why you would be apprehensive about this. It's a new vaccine, and you wonder whether people really know enough about it. On the other hand, we have something we think is safe. We've tested it pretty well, and we're balancing that against something which we know is dangerous, and that is being exposed to the virus. We know the virus has killed some 2,500 people in the city of Philadelphia so far. And so when you balance those out, it's a lot safer to take the vaccine than to not take the vaccine. But get all the information you can and make your own decision. But that's the way that I would weigh that. And I would explain that to everybody the same way.
Thank you.
Thank you, Dr. Farley, and thank you, Johan. Before I go to the next speaker, I just want to note we're under 15 minutes right now, so we won't have time for a second round of questions. And we still have about 7 or 8 folks to get through. So if everyone can keep their questions to 2 per outlet right now, just so we can be fair and get through everyone. And I know everybody's very interested in the vaccines, but if Dr. Farley has already addressed your question or something similar to it, let's hold that or send it to press@phila.gov so that we can get some new folks in here. So next up, we have David Melandra from Philly Sports Network. David, you can go ahead to ask your 2 questions.
First one's for Dr. Farley. There's a high school out in Minnesota and Wisconsin that have told their high school players, example for basketball players, to wear masks during the game. As the health commissioner of Philadelphia, are you going to enforce something like that for here in Philadelphia for all the high school athletes?
Basketball is a tough sport because I'm not sure how practical it would be for people to actually wear a mask while they're playing the game of basketball. It's a very strenuous activity. You breathe hard. It's hard to breathe through that mask. I think that we probably need to have other sorts of safeguards around basketball teams. And then the basketball teams may not be happy with those safeguards either. But I'm not really sure that wearing masks is practical during games.
Okay, and this one's for Mayor Kenny. As you know, Philadelphia gets to host a lot of interesting events over the years. As one of them is the Philadelphia Auto Show. Have you made a decision about when that's going to take place for 2021?
Not at the moment. We're still assessing large events, and most of the large events we've been doing are virtual. So, I can see the possibility of having an auto show that may be virtual, but I don't know at this moment because, again, we're still tracking the data.
All right, thank you.
Thank you, David. Next up, we have David Merle from Philly Mag. You can go ahead and unmute yourself and ask your questions.
Hi, questions for Dr. Farley. The first one on the subject of people declining vaccine. Do you have specific data on what proportion of eligible workers in the first group have declined to receive the vaccine?
I don't. I have some information from from one hospital system that it's clear that the percent that didn't get vaccinated, so we don't know if they declined or why they didn't get, the percent that didn't get vaccinated varies quite a bit by race. That it's the percent that did get vaccinated amongst those who was offered was much higher among other racial groups than among African Americans.
And I mean, just in general, can you share what that one hospital was in terms of overall?
Overall about, I think, in the high 70s or 80% of people offered the vaccine had already made an appointment and received it.
Got it. And second question, just on relating to, you said earlier that if you had more doses, more people would be getting vaccinated at present. I guess I'm sort of struggling to understand how that's the case if there's a backlog at present with the relatively limited number of people you're vaccinating. I mean, I understand if you have more doses, you could maybe broaden the scope of people getting vaccinated, but right now there are too many. You already have more doses than people to vaccinate. So can you explain how that's possible?
Yeah, well, again, remember, we're just starting up. And obviously on the first day, the percent vaccinated is 0%, right? The vaccine is just there waiting for people to come in. Over time, that percentage decreases. But if we had more vaccine doses to begin with, we would be opening up more sites. And so there would still be some doses out there waiting for people to be vaccinated, but there would also be more people vaccinated.
Thank you.
Thank you, Dr. Farley, and thank you, David. Next up, we have Jack Tomzik at the Metro. You can go ahead and ask your questions.
Yes, thank you. This is for Dr. Farley. With the 1B, I understand you said the vaccine working group is still considering who would be in that. Are they considering the people who are 75 and older?
Yes, that's amongst the considerations.
Okay. And with the restrictions, you mentioned that you'd be looking at that in the next few days. Will decision on whether those restrictions on indoor dining and the riskier activities, will decision on that come by the end of this week, or do you have? Or will it
we hope to have it by the end of this week. Yes.
Okay. All right. Thank you.
Thank you, Jack. Next up, we have Mike Donofrio from the Philadelphia Tribune. Mike, you can go ahead. Mike, just need you to, there you go.
So considering the history of African Americans with their relationship with the government's healthcare system, why didn't the administration make more efforts to ensure that African Americans and people of color were getting the vaccine?
Well, they're all having it offered, and there are efforts to deal with any concerns that they have. But it's not, no one's going to force them to take the vaccine, and I don't think you would support that either. And so all we can do is offer to people, make it easy for them to get it, and then to try to talk to them to address their concerns.
And you said hospitals, you asked hospitals to address this, but how are they going to do that? And can they be trusted to do it considering the numbers already? Like I'm saying they had months to prepare for this, and the numbers are what they are so far.
Well, I don't know that they had months to prepare for this, but they offer the vaccine a unit at a time. So like, the emergency department, everybody that was eligible for that. And they've had conversations, with people to try to figure out what are your concerns and how can we address those concerns. They're looking at those. And I don't think this is going to be something which is going to magically disappear no matter what they do. No one can force people to be vaccinated, but they have been working, will continue to work to make it easy for people to be vaccinated and to see if there's information or other things that will persuade them to be vaccinated. We've we recognize this problem. I seriously doubt that this is a problem unique to Philadelphia. I'm guessing this is a national problem and something that people are going to have to really try to address.
And just to be sure, because just to clarify, do you expect these racial gaps then to continue? Because you said it's not going to magically disappear.
Well, I hope that they narrow, and I hope that over time, I think what motivates people much of the, in many ways, is seeing someone like them who exhibited behavior and did well with it. So I hope that over time, as African-American staff people see some of their own coworkers or people that they respect who look like them, who've been vaccinated, feel good about it, that they will, if they were even initially reluctant, come around and be willing to be vaccinated over time. I think it's going to take a lot of conversations and a lot of continued opportunities for us to get there, and we'll track that to see if we can narrow that over time.
All right, thank you.
Thank you, Dr. Farley, and thank you, Mike. Next up, I have Martin Pratt from Philly, Your Black News. You can go ahead and ask your questions, Martin.
Thank you. Dr. Farley, would you or the health department commit to working with Black media to have these type of conversations on Black media platforms?
Absolutely. We've had outreach even before the vaccine arrived through Black media platforms and also through, for example, the Black clergy. We've had conversations. I met with large groups of them to talk through these issues. And I expected that we might have a problem like this when we got to the larger community. I was frankly surprised that we had this problem when we were just among healthcare workers. But so we're going to need to have as many African-American voices in discussion in the African-American community as we can around this. And I'm happy to participate in that.
Would you also bring the hospital administrators? And one last question, did anyone reach out to the Black Doctors Consortium? I know that on this new app called Clubhouse, there's a lot of Black doctors. This conversation kind of happens organically, almost daily on that app. And actually, Philadelphia is showing up on that app. So I'm wondering, has anybody reached out to the Black Doctors Consortium to have this conversation also?
Well, so we talk regularly with the Black Doctors Consortium. Dr. Stanford was, as you may remember, one of the first people he vaccinated and was vaccinated in a very high-profile way to serve as a role model. And I think that she is an outstanding role model here. And we will continue to, if I'm sure that she's willing to help out, and we will continue to ask her to talk about this.
And will you engage the hospital administrators in that same conversation?
Yeah, I'm talking to the hospitals on a regular basis. Now, they don't work for me. I can't order them to participate in a specific, interview, but I talk to them regularly, and I will encourage them to engage in this conversation.
Thank you.
Thanks, Martin. Next up, I have Alan Yu from WHYY. Alan?
Hi, can you hear me?
Yes, you're good. Go ahead.
Okay. Question for Dr. Farley about testing for the variant of the virus. Can you talk about where the testing for the variant would take place? Is it at the commercial labs like Quest and LabCorp? And if there are other places in the city or that the city has access to that could be testing, and tell me how you see the testing for that possibly changing over the next couple of weeks. I presume, you would want to know if this variant is circulating here as well.
Yeah, so you can't diagnose this new variant with just a regular test. It takes a very specialized test where you're sequencing the genome. You're figuring what's actually in the RNA of the virus. And so this can only be done in specialized laboratories. I know of 2 laboratories in the city, one at the University of Pennsylvania, one at the Children's Hospital Pennsylvania, or Children's Hospital Philadelphia, that can do that kind of sequencing. There's also a laboratory at the Centers for Disease Control that can do the sequencing. So they are getting samples from people who have already been tested in the city to do that sequencing. It's not something you can do in very, very large volumes. So it'll be a small number of people, which is why I put out the call for people who have recently traveled to the United Kingdom, so we'd be more likely to find it. So it's going to be difficult for us to do enough testing to get a sense for how much of this variant might be out here. And that's a national issue, not just for Philadelphia.
Okay. The other question is, I apologize, also about vaccines. So the state of New Jersey rolled out a pre-registration page for the general public today. And I'm just curious if that's something that the city of Philadelphia is considering for when we do get to, that phase of the vaccination process.
Well, we may consider that. We're a ways off from that, probably months away from that. Right now, we're trying to communicate more directly with people who are in the priority groups, like healthcare workers. There's a place right now for healthcare workers to get on our website to be notified. But the general population, we're down the line, and as we get closer to that, we'll figure out how we communicate with them.
Thank you.
All right, thank you.
All right, I have two more folks who are in line who didn't have the ability to raise their hand. First up is going to be Manny Smith from CBS 3. And then our final one will be Perla Lara from Impacto. So Manny, you can go ahead.
All right, both for, one for Dr. Farley and Mayor Kenny, and just kind of like editor to the press team. One of the issues is that the surrounding counties and even New Jersey are illustrating what the vaccine plan for distribution will look like. Like, we can easily tell, hey, in New Jersey, people will eventually be able to go to ShopRite. They can sign up and they know they have to wait in line until they meet the CDC guidelines for distribution. Can you talk about how that will look like in Philadelphia? I think it's hard for citizens to just keep hearing wait and just, hey, let us know what it might, look or feel like. Is it a website? Is it a mass vaccination? What will that look like?
First let me point out, by the numbers that I'm seeing, that we've distributed a higher percentage of our vaccine than either the state of Pennsylvania or the state of New Jersey. We think we're ways off from the general population. I think if people want to get a sense for what it's going to look like, it's going to look probably somewhat like how you can get testing right now. That you see a combination of different sites, specialized vaccination clinics, pharmacies, hospitals, other healthcare providers, federally qualified health centers. I'll take your suggestion, but can we lay that out sooner so people can see that? But again, it's going to be ways down the line. We're really, really dealing now with just the specialized populations.
Okay, and then with the city being one of the few municipalities that has kind of direct access to the vaccine, will the city have a different distribution plan eventually than from the state?
Yes, our distribution plan will be different from the state.
Okay. Can you elaborate on that at all?
Well, I don't know much details about how the state is going to distribute the vaccine because they're responsible for every other county. We're only responsible for Philadelphia. So again, what I've said about Philadelphia is it's going to be a combination of sites, specialized sites, healthcare providers, FQHCs, pharmacies.
No problem. I appreciate your answers and the work that you guys are doing. Thank you.
Thank you.
Thank you, Manny. And Perla, I know you said you had a question for Spanish language listeners. If you would like to unmute and ask that, and Armando can do the translation for us.
Y gracias. Felicidades a todos. Y bueno, pues un estudio reciente encontró que los trabajadores sanitarios de color tienen más del doble de probabilidades que sus contrapartes caucásicas blancos de dar positivo al virus. También, pues es el más del doble de contraer, de posibilidades de contraer el virus y señalar que el 20% de los que trabajan en salud nacieron en el extranjero. Eso es algo pues que obviamente muestra las inequidades. ¿Qué está haciendo? Si hay la primera pregunta es si hay estadísticas locales respecto a esta mortalidad y a esta infectividad que tenemos más las personas de color. Y segundo, ¿qué está haciendo la ciudad para revertir esta cosa injusta?
Muchas gracias, Perla. The question is for Commissioner Farley. Recent studies show that populations of color and contract the virus at twice or more than twice the rate of Caucasians and white Americans. There's also another study that says that the contract rate is higher for healthcare workers, of which 20% are foreign-born. My question is, because of these inequities, are there any local statistics about the death rate and infection rate for these populations, and what is the city doing about it?
There are. If you go on our website, you'll see the infection rate and the hospitalization rate and the mortality rate broken down by race. And it is generally higher among African Americans and Hispanics and whites. I don't think it's 2 to 1. It's more like 1.5 to 1. But we've been working for a long time to really try to get information out to minority populations about the importance of social distancing, which is the key tool we have to prevent this right now.
Nosotros tenemos esta información disponible en nuestro sitio web, Perla, y está disponible en tanto a la raza, en cuanto a la hospitalización y a la tasa de infectividad también. pero no creo que sea del doble o más del doble, es más el 1.5 al 1. Y por mucho tiempo nosotros hemos estado proporcionando información, tratando de llegar a diferentes poblaciones para tratar de transmitir el mensaje del distanciamiento social y las medidas que pueden tomarse para evitar la infección en toda población.
Estoy hablando sobre todo de los trabajadores sanitarios que están muriendo el doble que otros trabajadores, y estas son cifras nacionales de un estudio reciente que acaba de sacar The Guardian.
I'm referring specifically to healthcare workers, Dr. Farley, that are dying at twice the rate nationally speaking, and there's a study that has been published by The Guardian newspaper about it, specifically talking about healthcare workers, minority healthcare workers.
Well, I haven't seen that specific study. I would simply say, there's a lot of work that all the healthcare system has done to try to protect healthcare workers. They are, by their nature, more likely to be exposed because of the nature of their work. And that's why they're the first in the queue for being vaccinated. And as much as, we haven't vaccinated all healthcare workers yet, but everybody else is in line behind them because of the elevated risk of healthcare workers.
Bueno, la verdad es que todavía no he visto yo este estudio, pero tenemos entendido de que los trabajadores en el área de la salud, obviamente, tienen tasas más altas porque están más expuestos y es más probable que tengan esto. Sin embargo, por este motivo, están primeros en la fila y en la lista para ser vacunados y todos los demás vienen por detrás. Vamos a tratar de resolverlo de esta manera.
Sí, gracias. Nada más precisar de que justamente dentro de los trabajadores de la salud, los de color somos los que más estamos muriendo dentro del mismo grupo de trabajadores en general.
Thank you, and it's worth pointing out that within healthcare workers that have higher infectivity rates and are dying at a higher rate are color workers or people of color that are healthcare workers that suffer the most even. Thank you so much.
Thank you.
Thank you, Perla, and thank you everyone for joining today. If you have any remaining questions, you can send those to press@phila.gov, and we will see you next week for the next briefing. Have a good afternoon.